Good morning, everyone. My name is Kirsi Hipp, and I have done this presentation in collaboration with Adjunct Professor Anttila and Professor Välimäki. We all work in Department of Nursing Science in the University of Turku in Finland. Our topic is user involvement in research and especially in mental health research. I will discuss the challenges and opportunities to make a systematic review about this topic. We found this relevant in the light of evidence-based research, firstly to make contributions for future studies and also to present how to involve end users in the studies. User involvement in research means that service users have an active role and they are engaged in planning and conducting the research. Traditionally, health research has been done to, about, and for service users, and they have been involved mostly as participants of the studies. But here the user involvement means that research is done with or by service users. Shifting to this kind of user involvement can be seen in that some funding bodies require user collaboration and some journals that authors report how patients and public has been involved in different phases of the study. There is a strong emphasis on user involvement in mental health, has been for recent decades. So-called service user movement started with highlighting patients' active role in their own care and then more broadly in services and developing health systems and policies. And now the user involvement is increasing also in mental health research. User involvement has been reasoned as a principle and ethical right and patients' empowerment, and also by increased quality of research. Despite the increased user involvement in research, the concepts used are still inconsistent. For example, service users are also called consumers, survivors, people with lived experience, laypersons and service experts. It has been difficult to find one suitable term because people have different views on labeling liked and disliked terms. Reviewing the evidence is also challenging due to the variety of empirical methods used in these studies. Our aim was to identify the challenges and opportunities to conduct a systematic review on user involvement in mental health research. We wanted to know how user involvement has been studied, how it has been defined, and what kind of impact it has had in the studies. To find answers to these questions, we did a literature search in 4 electronic databases, Chinal, PsycInfo, PubMed, and Scopus. And the search phrase combined these terms, what you can see on the slide. The search was limited to English language articles published since 2010, and a narrative review was conducted. And next I will tell about what we found. Our first question was how user involvement has been studied. We included 22 articles and most of them were conducted in the UK. This was not surprising because the UK has a long and strong history of service user involvement in mental health. And in fact, they have a research network with one key interest to increase the involvement of patients and their carers in research. 6 studies were conducted in Australia, New Zealand, and 2 others in Denmark and Norway. 4 of the articles were reviews and 18 were empirical studies. The empirical studies most commonly used a qualitative approach, including interviews, focus groups, writings, and secondary analysis and action researches. 4 articles reported quantitative results, and they had include surveys, document analysis, and comparisons of how service user researchers and academic researchers had collected and analyzed the data. And 2 studies have used mixed methods. Our second question was about definition of user involvement. We found that this was associated with users' role in the research team. First, the users advise and consult the academic researchers who conduct the study. Users reflect and give feedback, for example, in steering groups and panel discussions. Second, users can act as co-producers of the research. This means that they are team members and have a collaboration and partnership with academic researchers in some or all stages of the research. They can, for example, be involved in developing interview guide, conducting interviews, coding transcripts, and reflecting the results. This co-production has kind of sub-levels based on who is initiating the collaboration. Is it academic researchers, service users, or is it jointly initiated? The highest level of user involvement in research is leading role. This means that the users control and conduct the study. Of course, user-led study may involve also academic researchers. Our last question was the impact of user involvement. The literature indicates that user involvement has a potential in identifying research topics that are relevant, planning the study designs, and ensuring that research is conducted in an ethically sustainable manner. However, involvement in planning is quite rare, and when the users are invited to the study that has already begun, they might feel unable to influence it. One largely noted positive impact is to promote recruitment and the data collection, especially when interviewing patients and service users. The users can have better access and trust in hard-to-reach participants. They have also ensuring that measures and forms are accessible to the target population. User involvement has a potential to enrich and deepen the analysis. The users can find different kind of interpretations of meanings and connections in the data, and they can prevent misunderstandings. This is, of course, a potential to produce more richer knowledge. Users can be involved in writing, and like I said in the beginning, some journals value the user involvement in their publication. User involvement can promote user-centeredness in reporting, and that recommendations made are pragmatic, realistic, and relevant for service users. In dissemination, service users can make the outputs more accessible, and the results are maybe more noted when users are involved. Surely there is still a chance that user research studies are not taken so seriously. User involvement has also reported to have personal benefits like empowerment, social inclusion, learning, and making a career, but this was outside of our topic now. Of course, these impacts are not something that comes automatically when users are involved. Successful implementation requires that the value of user involvement is recognized and there are adequate resources. Based on this narrative review, we concluded that challenges to conduct systematic reviews comes from inconsistent reporting of user involvement. For example, some studies only provide information that users were actively engaged in every phase of the study. Also, one issue worth to notice is multiple roles. Some academic researchers use mental health services, and service users may have academic education. We included the studies that focused on user involvement, but there is also plenty of articles in which user involvement has reported as a strategy. And when doing systematic review, it is important to decide whether to include both kind of articles or only either one of them. In addition, if you want to review some specific topic studied with user involvement, you might struggle with lacking literature. For example, Professor Happel and her colleagues in Australia reviewed user researches about improving physical health and found only 4 eligible studies. Our findings demonstrated that user involvement has in many ways potential to promote the quality of research. It is important to explore how to increase user involvement in empirical studies, not only in mental health, but other study areas as well. The evidence-based research is also to help us researchers to find knowledge gaps. More research in this topic is needed in general, and especially evidence of academic research's experiences is lacking. In addition, we found more results on the potential impact and kind of an idealistic description of user involvement. But the studies also reported that user involvement can be tokenistic, especially when their involvement is required and they are invited for that reason. More research is needed on the authentic engagement. And when thinking about systematic reviews, it is important that the involvement is well reported in the empirical studies. Here you can find the references of the included studies in 2 slides. Thank you for your interest. Here you can find my email address. Don't hesitate to contact me to continue the discussion also after the conference. So, thank you so much.